I love you guys, but some of these dry eye tips I see online, whew,
There's a lot of confusion around this issue.
some of them make me laugh, and some of them make me want to personally confiscate your eye drops. So today, we are separating fact from fiction and going through the top dry eye myths that you need to stop believing. All right, let's jump in. Hi, I'm Dr. C, Double Board-Certified Optometrist, dry eye specialist, and the owner of Eye Drop Shop. I'm here to simplify complex eye issues and give you science-backed tools that actually help you feel better faster. Today, we're talking about dry eye myths, and let me tell you, I have heard all of them.
I've heard them all.
I could make dozens of videos on this topic, but we're gonna focus today on the top 5 that I hear and read about every day, whether it's in clinic, online, in DMs, at brunch. What they do is they actually lead people to the wrong treatments, the wrong products, and the wrong assumptions about their symptoms.
They cannot be trusted.
Before we jump in, don't forget to subscribe, like, and ring the bell so you don't miss future episodes. And make sure to comment below with any myths that you've heard and want me to debunk. Maybe I'll include it in a future part 2 of this video. Myth number 1, dry eye is just a minor irritation. This could not be further from the truth.
There's more to it than that.
Dry eye is an actual medical condition, a chronic one, and when it's not managed properly, it can cause inflammation, discomfort, damage to the surface of the eye, fluctuating or blurry vision, and reduced quality of life. I see patients all the time with dry eye, and I cannot tell you how much it impacts their quality of life. It can impact productivity, comfort, the long-term health of your eyes. This is not something to be taken lightly. Dryness is not a small, simple thing. If your eyes are dry, they're trying to tell you something important, and we have to take it seriously. A little PSA also, we should take it seriously when our families, friends, and coworkers talk to us about dry eye, because they truly are suffering and they need our help. Myth number 2, eye drops are all the same. This one actually blows my mind because I hear it every single day in clinic. Eye drops are not the same. I am here to set the record straight.
I know it. I know it. I know it.
First of all, there's different kinds of eye drops for different issues of the eye. Using the wrong type of drop can actually either make your symptoms worse or do nothing. For example, if you have meibomian gland dysfunction, which is extremely common, and you use regular watery-based tears, you're not really going to do anything because what your eye is lacking is the oily part. So in these cases, you want lipid-based tears. So if you've tried 1 or 2 drops and thought, you know what, these drops just don't work for me.
I've tried everything.
It might be because you haven't tried the right one for your type of dry eye. Matching the drop to the diagnosis makes a huge difference and is the whole reason your optometrist is trying to find your root cause. Myth number 3, dry eye only happens in older adults. This is so false, so false.
This is a lie.
Yes, dry eye is more common when we age, but I am seeing dry eye in people younger and younger and younger these days, and it is at a record rate. The main reason for this is honestly screens. Phones, laptops, tablets, gaming. When you stare at a screen, your blink rate drops by about 60%. So your tears will evaporate faster, your eyes dry out, and the irritation will just set in. But screens aren't the only reason younger people get dry eye. It could also be caused by so many other things like contact lens wear, autoimmune conditions, medications that people are taking, hormonal changes, LASIK surgery. I mean, the list can go on and on. I diagnosed dry eye in teenagers, in people in their 20s and 30s. Sometimes even little kids as young as 5 have dry eye disease. So it's definitely not just an older adult condition anymore, and we should start to look for it in younger and younger patients. Myth number 4, if my eyes water, I don't have dry eye. Actually, watery eyes are often one of the biggest signs of dry eye, and here's why. When your eyes get too dry, your brain sends a message to your tear gland saying, "Help, we need tears right now." So your eyes actually produce a flood of reflex tears, but these are made quickly and really are not great quality. So instead of sticking to the eye, they'll just run down your face. So your eyes will water, but they still feel irritated and dry. It's kind of like trying to moisturize dry skin by splashing water on it. It just doesn't work. So if your eyes are tearing constantly, don't rule out dry eye. In fact, it's actually one of the first things I check during an eye exam. Myth number 5, there's nothing you can do about dry eye. Dry eye is extremely treatable, especially today. There are more options than ever before to find relief. There's the at-home treatments we talk about, like eye drops, warm compresses, omega-3s, and lid hygiene. And then there's the in-office ones that I'm always talking about, like IPL, radio frequency, and the slew of treatments that we offer in clinic. The truth is, the best results come from when you combine treatments based on the actual cause of your dry eye. So don't give up. Dry eye is absolutely manageable with the right plan. And there you have it, the top 5 dry eye myths that we need to stop believing yesterday. If you fallen for any of these myths or others I didn't talk about, let me know in the comments. I really want to hear about it and your experiences. And if you learned something today and love learning about eye health, hit like and subscribe. You don't want to miss any of our future episodes. It also really helps the channel. I'm Dr. C. Take care of your eyes, blink often, and I'll see you in the next one.